Imagine going through like this massive life-altering surgery to get healthy. You do everything perfectly. You endure the procedure, you heal up, the weight starts coming off, and you just feel fantastic.
Right, you feel like you've won.
Exactly. You feel great. But then about maybe 18 months later, you just hit a wall.
Yeah.
Profound fatigue sets in. Your hair starts like thinning and falling out in clumps. Your brain fog is so thick you can barely focus on anything. And then your blood work shows you are severely anemic.
It's a completely terrifying scenario. And unfortunately, in the world of post-bariatric surgery, it's not an anomaly. It is incredibly common.
Up to 50% of patients actually fall into this exact trap.
Yeah, up to half.
It's wild. So today on the deep dive, we are looking at why that happens. We're completely dismantling this common assumption that weight loss surgery is just about eating less.
Right, because it's so much more than that.
Exactly. Instead, we're exploring the fascinating hidden structural changes that the body undergoes post-surgery. We really want to uncover the precise, lifelong nutritional roadmap you need to keep that brand new anatomy functioning safely.
Which is, an essential conversation.
Yeah.
Because the sheer mechanics of digestion, like the actual rules your body has followed since you were born, they are permanently rewritten overnight.
Yeah. So whether you are prepping for your own procedure, maybe you're supporting a loved one through it, or you're just someone who loves learning about the hidden biological mechanics of the human body, you're going to get some massive aha moments today.
Definitely. There's a lot of surprising science here.
So let's unpack this, because before we even talk about what people need to eat or take after surgery, we really have to talk about why the standard rules of digestion are basically taken offline.
Right. And to do that, we have to look at a foundational clinical concept from the sources. It's known as the anatomical triad.
The triad, okay.
Yeah. When someone undergoes weight loss surgery, whether that's a Roux-en-Y gastric bypass or a sleeve gastrectomy, three major structural changes happen that just completely overhaul how the body processes fuel.
Right.
First, the stomach pouch is made significantly smaller. And that's the part everyone knows about, the volume restriction.
You physically can't eat as much.
Exactly. But the second and third parts of the triad, that's where the real physiological challenges actually begin.
The absorption and the acid.
Yes.
I was thinking about this. Let's think of digestion like a factory line. Under normal circumstances, you have a really long conveyor belt.
Okay, I like that analogy.
Right. So early on in the process, the raw materials, your food, they drop down into the stomach and get dunked into this intense chemical acid bath.
Right, a highly corrosive bath.
Yeah. And that acid breaks the molecular bonds of the food, unlocking all the vitamins and minerals so the workers further down the line, your intestines, can easily grab them.
Exactly. And that acid has a pH similar to battery acid, which is...
Wait, battery acid?
Basically, yeah. And it's exactly what's needed to liberate heavy things like iron and calcium from the matrix of the food you eat.
Wow. But, okay, with bariatric surgery, we drastically shorten that conveyor belt. We bypass a lot of the surface area where those factory workers do their jobs.
Right, the lower absorption area.
And crucially, we've almost completely removed that initial chemical acid bath because the part of the stomach that produces that acid is largely gone or bypassed.
Exactly. So that triad reduced volume, reduced absorption area, and drastically reduced acid, it creates a profound functional change.
Okay, hold on, though. I want to push back on this a little bit.
Sure.
If they bypass the intestine and remove the acid, how are they absorbing any nutrients at all? Doesn't the whole system just shut down?
Well, no, it doesn't shut down completely because the surgery doesn't remove the entire digestive tract.
Okay.
With a bypass, they leave enough of the lower intestine to absorb macronutrients. So your proteins, your fats, your carbohydrates.
So you don't starve.
Right, you get your calories. But they bypass the upper section of the small intestine. Specifically, a section called the duodenum.
The duodenum.
Yeah, and that specific section just happens to be the primary absorption site for critical micronutrients like iron and calcium.
Oh, wow.
So you bypass that and you create this enormous absorption gap.
Which completely blows up a major myth I hear literally all the time. People think, well, I'll just eat a perfectly clean, nutrient-dense diet of organic whole foods.
Oh, yeah, the out-dieting myth.
Right. But if I'm understanding this triad correctly, it honestly doesn't matter if you put the highest quality spinach and, wild-caught salmon onto the belt.
No, it doesn't.
The factory physically cannot process them the way it used to.
Exactly. That idea of out-dieting the surgery is one of the most dangerous misconceptions out there.
Wow.
Even if a patient consumes just a flawless post-op diet, the physical mechanism to absorb enough trace minerals and vitamins from food, it simply isn't there anymore.
It's just gone.
Right, so bariatric-specific supplementation isn't just like a good idea or a helpful little boost. It is a permanent structural necessity.
Okay, but if the math says they can't absorb food, why aren't they just crashing on day 2? Like, what actually happens when that factory line fails over time?
Well, the clinical reality is pretty stark. If you look at the guidelines from the American Society for Metabolic and Bariatric Surgery, the ASMBS, the numbers are alarming.
What do they say?
Iron deficiency occurs in 20 to 50% of patients within the first 2 years.
50%, that's half.
Yeah. And vitamin B12 deficiency hits roughly 30% of gastric bypass patients within 24 months.
Jeez.
And then vitamin D insufficiency, the clinical data describes it as nearly universal.
Nearly universal, meaning almost everyone will be deficient if they aren't supplementing correctly.
Exactly.
But the timeline is what really fascinates me here. Like, you don't wake up from surgery the next day with 0 iron in your blood.
No, you don't. And that's because the human body is incredibly resilient. It actually has storage tanks.
Storage tanks.
Yeah, your liver, your bone marrow, your fat tissues, that warehouse supplies of these crucial nutrients.
Oh, I see. Which creates this false sense of security.
A huge false sense of security.
Right, because patients often sail through this early honeymoon phase. The weight is coming off rapidly, they feel amazing, and their lab work at, like, the 3-month mark looks perfectly fine.
Right, but it's only fine because the body is just desperately draining its previous reserves of B12 and iron to compensate for that absorption gap.
And eventually, those tanks just run dry.
And when they do, the crash is severe, like we talked about earlier.
Right.
But there's a really vital exception to this long timeline that we definitely need to highlight.
Okay, what's that?
Thiamine, which is vitamin B1. A deficiency in thiamine can manifest in mere weeks.
Wait, really? Why does thiamine run out in just a few weeks while iron takes, like, over a year?
Because thiamine is a water-soluble vitamin.
Oh, gotcha.
Yeah, unlike fat-soluble vitamins or heavy metals like iron that we can easily stockpile, we naturally urinate out excess water-soluble vitamins every single day.
So we don't hold on to it.
Right. Our internal storage capacity for thiamine is tiny. And this is particularly dangerous in the early post-op period because patients often experience really intense nausea.
Oh, right. Because their stomach is healing.
Exactly. So if a patient is nauseous and they're constantly vomiting, they aren't retaining any thiamine, and the body just burns through its meager reserves incredibly fast.
And the symptoms of these deficiencies are brutal. I mean, from what the sources say, we're talking about way more than just feeling a little sleepy.
Oh, absolutely.
It's new onset anemia, brittle nails, severe brain fog where you literally can't remember basic words.
Yeah, it's systemic.
But patients so frequently dismiss these red flags, don't they? They just normalize it.
They do. They think, oh, I'm just tired from the surgery recovery, or hair loss is just a normal part of rapid weight loss.
Which is such a tragic mistake.
It is. And it usually happens because the patient just assumes the generic multivitamin they bought at the grocery store is protecting them.
Oh, man.
But generic vitamins are designed for the standard factory line. You know, the one with plenty of battery acid and a really long conveyor belt.
Right, the original anatomy.
Yeah. Taking a standard grocery store vitamin after bariatric surgery is, well, it's like trying to swallow a watermelon whole.
That's quite a visual.
But it's true. The machinery to physically break it down and process it just isn't there anymore.
So the difference between generic vitamins and bariatric vitamins isn't just like a marketing story. It's a hardcore clinical story.
Exactly.
Which brings us to the chemistry of it all. If generic vitamins fail the clinical test, what exactly does a successful bariatric-specific formula even look like?
Well, to understand the mechanics of this, clinical nutritionists point to formulas that are engineered specifically for post-bariatric physiology.
Okay.
A really great blueprint for this from our sources is a formulation called Liquid Force.
Right, Liquid Force.
Yeah, it's a prime example of the exact chemistry required. Because we aren't just talking about jamming higher doses into a pill, we are talking about utilizing entirely different molecular forms of the vitamins themselves.
The bioavailable forms.
Exactly.
Let's really break this down because the underlying science here is just fascinating.
It really is.
So the Liquid Force formula delivers 29 essential bariatric-specific nutrients, but it's delivered in a liquid-filled gel capsule rather than a hard, chalky tablet.
Right.
Why does that specific physical delivery method matter so much?
Think back to the shortened factory line and that tiny stomach pouch we talked about.
The egg-sized pouch.
Exactly. A hard tablet takes time, it takes heavy stomach acid, and it takes intense mechanical churning from the stomach muscles to break down.
And the post-op stomach just can't do that.
No, it simply doesn't have the space, the acid, or the muscular force to churn a heavy, chalky pill comfortably.
So it just sits there.
Yeah, and it causes nausea. But a liquid-filled gel capsule, that bypasses that entire mechanical breakdown step. It dissolves super quickly and is vastly gentler on the new anatomy.
Okay, so that makes perfect sense physically. But let's look at the chemistry.
Sure.
The clinical data specifically emphasizes the need for calcium citrate, not calcium carbonate, which is, what you find in almost every cheap generic vitamin on the shelf.
Yeah, calcium carbonate is everywhere. And this highlights the missing acid bath perfectly.
Oh, so?
Regular calcium carbonate requires a highly acidic environment to break down and actually be absorbed.
Oh, I see.
So if you don't have normal stomach acid, you will just pass that calcium right through your system unabsorbed. It's completely useless.
Wow, just flushed away.
Yeah. But calcium citrate, on the other hand, undergoes a completely different chemical process. It does not require stomach acid for absorption.
Oh.
Yeah, it's biologically ready to be taken in by the shortened intestines right out of the gate.
It's like it's pre-unlocked for the factory workers.
That's a perfect way to put it.
Yeah. And I'm guessing the same logic applies to the iron, right? Because the blueprint formula uses 45 milligrams of bariatric-grade iron bisglycinate.
Yes.
And I've read that normal iron supplements absolutely wreck your stomach, like causing intense cramping and constipation. So why is this bisglycinate form considered gentle?
It all comes down to how the iron molecule is structured. With iron bisglycinate, the iron is chemically bound to an amino acid called glycine.
Okay.
This essentially hides the iron from the stomach lining, which prevents all that irritation and cramping that regular iron salts cause.
That's clever.
Right. And furthermore, that amino acid bond allows it to be absorbed more efficiently in the intestine without relying heavily on that missing stomach acid.
Man, the engineering there is incredible.
Yeah.
But we also have to talk about the B12 because this honestly blew my mind.
It's a big one.
Yeah. It's not just a massive dose of regular B12. The source says it's 500 micrograms of something called methylcobalamin, and it's sublingually bioavailable.
Yeah.
Break that down for us. What does that mean?
Well, generic vitamins usually use a form called cyanocobalamin, and when you ingest that, your liver literally has to cleave off a cyanide molecule and convert it before your body can actually even use the vitamin.
Wait, it takes actual metabolic energy just to process the vitamin?
Exactly. It takes time and energy. But methylcobalamin, that is the active form. It's ready to go.
And the sublingual part?
Sublingually bioavailable just means it can be absorbed directly through the mucous membranes, like under your tongue and throughout your digestive tract, passing straight into the bloodstream.
So it literally skips the complicated digestive conversion process entirely.
Completely skips it.
That is so cool. Okay, so you've got all these perfectly engineered nutrients, the pre-unlocked calcium, the gentle iron, the active B12, plus like a hefty 3,000 IUs of vitamin D3 to combat that near universal deficiency.
Right, it's all in there.
But here's where the chemistry creates a massive operational problem, doesn't it?
Yeah.
You can't just throw them all down the hatch at the exact same time.
No, you definitely cannot.
Because there's a fascinating chemical conflict between calcium and iron. They actually compete for the exact same receptors in the body.
They do.
I picture it like trying to shove two people through a single revolving door at the exact same time.
And what happens in the revolving door?
Neither gets through, they just get stuck, and the whole system jams up.
That's a highly accurate visual, actually. In the gut, large amounts of calcium will physically bind with the iron, forming this insoluble mass that your body can't absorb.
So it just gets passed as waste.
Yep. And it's why there is a strict, non-negotiable rule that clinicians really hammer home. Iron and calcium must be separated by at least 2 hours.
2 whole hours.
At least. If you take an iron supplement with a glass of milk, or, if you take a cheap multivitamin that lazily lumps heavy calcium and iron into a single pill, you are essentially neutralizing the iron.
You're taking it, but you aren't actually absorbing it.
Exactly.
Okay, so chemically, this bariatric-specific formula solves the absorption gap. But I'm looking at these deficiency numbers again from the start. If the math checks out and the chemistry works, why are up to half of these patients still crashing at 18 months?
Well,
Are they just like forgetting to take the pills?
honestly, That is exactly the issue. The most perfectly engineered gel capsule in the world does absolutely nothing if it just stays in the bottle on your bathroom counter.
Right.
This is where we have to shift gears from biological science to behavioral science.
Which is where a 20-year bariatric nutritionist from our sources comes in. They provide this framework, outlining what they call a resilient protocol for surviving real life.
Yes, a resilient protocol.
And it starts immediately. Post-op day 1.
Right. Waiting until the 4-week checkup to start your vitamin regimen is a remarkably common and costly trap.
Because of the thiamine.
Exactly. As we discussed, thiamine deficiencies can start forming in a matter of weeks. You have to start protecting the factory line from day 1, establishing the routine while you are still, hyper-focused on your recovery.
That makes sense. But how do you actually make the habits stick long-term? Like, the protocol talks about tying the vitamins to an anchor. What does that actually look like in practice?
So an anchor is an existing, unbreakable daily habit, something you do every single day no matter what.
Like brushing your teeth?
Exactly. If you place your vitamin capsules right next to your toothbrush, you don't have to summon the willpower to remember your vitamins.
You just have to remember to brush your teeth.
Right, which is already hardwired into your brain. The protocol strongly suggests taking them in the morning with water tied directly to that morning anchor.
Okay, I have to admit, though, I would probably mess this up because my morning anchor is immediately drinking a massive cup of coffee.
Oh, yeah.
And apparently, according to the deep dive sources, that's a huge problem.
Coffee is a massive hurdle. It contains compounds called tannins.
Tannins?
Yeah, and tannins act like chemical magnets in your digestive tract. When they encounter an iron molecule, they latch onto it and form a brand new complex compound. The problem is that this new compound is physically too large to pass through the microscopic pores of your intestinal wall.
So you just flush the iron away?
Precisely. The tannins physically block the absorption,
Mm-hmm.
so the clinical rule is really strict. You must separate your bariatric vitamins from your coffee or black tea by at least 30 minutes.
Okay, so the practical routine is like, wake up, take the vitamins with a glass of water, go shower, get dressed, and then have the coffee.
Yep, that works perfectly.
That's a totally doable adjustment. But the nutritionist shares a clinical pearl here that I think is the most profound takeaway for anyone trying to build a new health habit.
What's that?
They write that in 2 decades of practice, the biggest predictor of success isn't willpower, it's simplicity.
Oh, 100%. Simplicity is everything when you are designing a habit meant to last for decades.
The routine must be boring, repeatable, and resilient.
Right.
Like these complex 6-pill stacks where you're taking 2 horse pills at breakfast, another specific pill at lunch, and 3 more at dinner, they inevitably fail.
Because people have jobs, they travel, life just gets chaotic.
Pill fatigue is a very real psychological phenomenon.
It really is.
But a simple 2-capsule daily dose, like the one offered by our Blueprint formula, it succeeds precisely because it removes all that friction.
If we look at human psychology, consistency will always beat perfection.
Always.
The patients who take their simple 2-capsule bariatric multivitamin every single morning, even on chaotic travel days, even on days where their diet consists of less than ideal foods, those are the patients who have drastically fewer deficiencies at their 1-year lab checks.
Consistency beats perfection. That is definitely a mantra to live by.
Absolutely.
So, if the protocol can be made this simple, why do so many people still end up back in the clinic with severe issues years down the line? Like, what is the final trap that catches people off guard?
The biggest trap, by far, occurs when the weight loss finally stabilizes.
You mean when they hit their goal weight?
Yes. The patient feels fantastic, their clothes fit perfectly, they are eating a normal, albeit much smaller diet, and this dangerous psychological shift happens.
They think they're done.
Exactly. They think, I'm cured, the surgery worked, I don't need these expensive bariatric-specific vitamins anymore, so they just stop taking them.
Wow.
Or, they downgrade to a cheap, regular multivitamin from the pharmacy to save a few bucks.
And that is the exact moment the storage tanks finally run dry.
And the crash happens. As we noted earlier, the deficiencies don't show up on day 2. They show up at month 12 or month 18 or year 3.
Right.
Stopping the specific supplements when you feel your absolute best is a fundamental misunderstanding of the surgery itself.
Because the anatomy is still altered.
Exactly. The anatomical changes, the smaller stomach pouch, the bypassed intestines, the low stomach acid, those are not temporary states. They are permanent structural realities.
Right.
Therefore, the specialized supplementation must also be for life.
There is no finish line.
There is no finish line, and that's why scheduled lab work is just non-negotiable.
What's the schedule for that, usually?
The guidelines mandate comprehensive blood work at 3, 6, and 12 months, and then annually for the rest of the patient's life.
Annually forever.
Yep. Preventing a deficiency with a simple 2-capsule morning habit is incredibly easy. But correcting a severe iron deficiency once your nervous system is impaired or your blood counts have completely crashed.
That sounds rough.
It is. That requires a long, difficult, and sometimes really painful clinical intervention, often involving 5e infusions.
Oh, wow. Let me ask about the different procedures, though, because we hear a lot about gastric bypass versus the sleeve.
Sure.
Are there differences in these long-term malabsorption realities based on which specific surgery you get?
There are some important nuances, yeah. Gastric bypass patients generally face a significantly higher risk of severe rapid deficiencies,
Okay.
specifically with iron, B12, calcium, and fat-soluble vitamins like A, D, E, and K.
And that's because more of the conveyor belt is physically bypassed and removed from the equation, right?
Right. The sheer square footage for absorption is just drastically reduced.
Makes sense.
Now, gastric sleeve patients, they have their intestinal plumbing kept largely intact, so they generally have fewer severe malabsorption issues regarding surface area.
Oh, they're in the clear.
No, and this is a critical, however, that gets overlooked all the time. Sleeve patients still have 80% of their stomach removed.
Oh, right. Which means the acid factories are still missing.
Exactly. You still have the long conveyor belt, but you've completely shut down the chemical prep station. The drastic reduction in stomach volume and acid production means sleeve patients still struggle to liberate nutrients from food.
Because they can't break it down.
Right. So the structural mechanics are still permanently altered, meaning sleeve patients also require lifelong bariatric-specific supplementation.
Wow. Okay, so to summarize the journey we've taken today, navigating the bariatric diet isn't just about eating small, healthy meals to lose weight.
No, not at all.
It's about fundamentally understanding that you are operating a permanently altered digestive machine, a machine that requires highly specific, chemically engineered fuel like the pre-unlocked calcium, the sublingual B12, and the gentle iron, just to bridge the gap between what you eat and what your body can actually absorb.
Yes. It requires a profound shift in mindset from short-term dieting to lifelong structural maintenance.
It's about consistency over sheer willpower.
Exactly.
Finding a boring, resilient routine that fits into your life rather than fighting through complicated pill stacks. And, maintaining the vigilance to keep checking those labs year after year, even when you feel amazing.
That is the true underlying key to thriving post-surgery.
Well, to everyone listening, thank you for joining us on this deep dive. It's a highly technical topic, but understanding the hidden biological mechanics of clinical nutrition is just so empowering.
It really is.
Whether you're navigating the surgical journey yourself, or you're just fascinated by the limits and adaptations of human biology.
I'd like to leave you with one final thought to ponder.
Please do.
We've spent all this time today talking about how catastrophic it is when we alter the body's digestive factory line. We see how fast the entire system fails without that intense stomach acid and that long, perfectly calibrated intestinal conveyor belt.
Yeah, it falls apart quickly.
So consider this. If the human body requires such an incredibly precise, highly acidic, and lengthy physical process just to extract the invisible building blocks of life from an ordinary meal, how many other subtle, unseen structural processes in our own bodies are we completely taking for granted right now simply because they haven't been permanently altered?
Wow. Think about that the next time you sit down to eat. The engine is always running whether you see the mechanics at work or not. We'll catch you next time.